The following is not typically seen in a patient with femoral neck fracture. So when there is femoral neck fracture which will not occur, that means which is not true regarding the femoral neck fracture. Here the options are malunion, non-union, avascular necrosis, shortening and external rotation. So first of all, let's see some of the femoral neck fracture. Here we can see this is the femoral neck fracture, which is the intracapsular. That means it is located within the capsule. We know the femoral neck, it is partially covered by the capsule like this, and some of the part are not capsulated. And the second area is the extra capsule. That means outside the capsular area, such as this area is the capsular and this area is the non-capsular or extracapsular. So extracapsular fracture also occur. Then there we can see this is the intertrochanteric fracture, and this fracture it extends from the greater trochanter to the lesser trochanter, and also intertrochanteric, but there is unstable. That means there is the lot of the fracture fragments and it is the unstable fracture intertrochanteric. Then the final one, here we can see the subtrochanteric. That means this is the lesser trochanter, this is the greater trochanter. So the fracture it is occur below the greater and lesser trochanter, it is known as the subtrochanteric fracture. So it is the fracture of the femoral upper part. Now see, this is the intertrochanteric fracture and transverse neck fracture, subcapital neck fracture, lesser trochanter fracture, greater trochanter fracture, and the subtrochanteric fracture. So these are the fracture of the upper part of the femur, and actually the most are seen the intracapsular fracture. So let's see the femoral neck fracture, malunion. In case of femoral neck fracture, the malunion usually not occur. That means the joining occurs, but deformity it is unusual. Why unusual? Because he is a weight bearing joint. So huge weight goes from the upper part to the lower part of the body. For this condition, malunion not possible. Other complication of the bone healing they may develop, such as the non-union, avascular necrosis. These are possible, but malunion not possible. If the fracture is not united, then it does not heal at all. And it is for this reason the most femoral neck fracture are fixed. So most of the femoral neck fracture are fixed. Avascular necrosis may be a complication, and it is a well-known complication, because when there is the fracture of the femoral neck occur in this condition, the retinocular branch of medial lateral circumflex femoral artery they may be destroyed, and finally there is loss of blood supply to the femoral head, and finally there is the avascular necrosis develop. Total hip replacement or hemiarthroplasty is usually considerable in the elderly. Actually the hemiarthroplasty are considered in case of the elderly, and total hip replacement it usually in the younger patient. But in the older patient, if the patient is stable, normally fit, can work day-to-day activity, in this condition total hip replacement may be another option. So which is not typically seen in case of femoral neck fracture, it is the malunion, because there will be union or non-union, but there is no chance of the malunion because it is a weight bearing joint. As it is the weight bearing joint, so there is no possibility for malunion, but non-union may be possible. Avascular necrosis is a potential complication or well-known complication. Shortening also occurs when there is malunion or when there is non-union, and external rotation it usually occurs following the trauma. So this is all about the complication of the femoral neck fracture.